few of you from work in the past. We're really excited that you're looking at expanding or adding FCS to your book of business. So thanks for being here with us today. We're going to do some quick introductions with our team. So I'm changing slides on the wrong PowerPoint, so that's always fun. Because, you know, multiple screens. I'll start. My name is Kimberly Castle. I'm the Supportive Housing Program Manager for Foundational Community Supports for Western Washington. So I represent all of you in housing on the west side of the mountains. I will let my team also introduce themselves. So Rand, do you want to go next for housing?
Sure. So I'm Kimberly's partner, and I have all of you on the east side of the state do the same thing, technical assistance, and I'm really excited to watch these programs grow. So I'm happy to be here, and I'm glad you guys are here.
Don or Darren, do you want to go next?
Sure. Hi, everybody. My name is Darren Paske. I'm the Supportive Employment Program Manager with a focus on Western Washington to provide technical assistance, IPS fidelity reviews, and help develop programs. Thanks for joining us today. Over to you, Don.
Good afternoon. I'm Don Miller. Pardon me. And please let me know if you can't hear me. I've got kind of a coldish thing going on. I'm the Supported Employment Program Manager for the east side of the state. So Darren's bookend and also Rayanne's bookend. Rayanne and I work on the east side of the state together. Darren and I work together for supported employment. So I also do training, supported employment fidelity reviews. Lots of other duties as assigned, just the same as the rest of the group here. And I'm thankful that you're here today.
All right, so that's the lovely FCS trainer team. We are the folks that you'll be working with to implement and get these programs going or expanded. We are your go-to folks for all things supportive housing and supported employment. So please feel free to reach out to us as you are working through these programs to connect with us. We are always happy to do one-on-one work with you, as well as work with your team and agency as a whole to really make this a successful project for you. So now I'm going to ask everyone to, in the chat, put your name, maybe your position. Are you doing supportive housing or supported employment? Are you expanding, or is this brand new to you? So we'd be really happy to just know a little bit of the information that's on the slide in the chat, so we can kind of get to know who's all here and what we're doing regarding the FCS program. We know we have some folks that are brand new to this, some folks that are very versed in FCS already. So we want to get to know you a little bit. And then Dawn, I'm going to turn it over. Oh, I'm sorry, what?
All right. I was going to say, do please, if you're doing both supportive housing and supported employment, let us know that that's the case, because the majority of agencies, in fact, are doing both. All right. So homelessness and unemployment have been linked to the things that you see there. I think it's always been pretty apparent to folks why it is that homelessness is linked to increased health issues, increased depression, unhealthy coping mechanisms, maybe a little less so when it comes to a job. Although if you all think about the importance of your job, what it does for your mental health, what it does for your health, in fact, I think it becomes more apparent. But I wanted to share, there is a study, and in fact more than one, but one specifically that showed individuals that are chronically unemployed die up to 25 years earlier than those of us that are typically employed. And if you think about it, when you have no income to pay for your health needs, buy good food, to keep a roof over your head, if you don't have that connection with others and that kind of thing, it becomes obvious why employment is one of the social determinants of health. Almost as obvious as why housing is one of the social determinants of health. Next slide, please. I apologize, I don't have slides right in front of me, so I'm not sure who's doing this one.
You are.
All right, I can do that. So supportive housing and supported employment. The intent to improve upon them for people in the state of Washington happened a number of years ago with the policy academies. There's one for supportive housing and one for supported employment. The one for supported employment was an Olmsted Policy Academy. I'm sure the Supportive Housing Academy went similarly, but the intent was a group of stakeholders from across the state ended up getting together and starting to talk about what were some of the barriers, what were the issues, what were the challenges, and what information were we lacking. So we reached out to a number of different states in order to get education on different kinds of Medicaid that were being used, on different kind of relationships with DVR, you know, kind of the way that the services looked in states that were being highly successful, particularly with employing people that had significant mental illness. Because at the point in time we participated in the Olmsted Policy Academy, the employment rate of people with serious mental illness was 14%. Unemployment rate, 86%. That's heinous. And so what came from that was a strategic plan in each case, one for housing, one for employment in regards to what it was that we needed to do in order to move forward. Fast forward, the state decided that the 1115 transformation project, Medicaid transformation project, fit what the state needed and what the program that we were proposing needed. There were demonstration programs, Porch, Bridges, HARPS, BEST, TANF supported employment program, all of which started collecting data about what would then become foundational community supports. During the process of doing that, the legislature mandated that we use evidence-based or promising practices to provide the services. So when you hear us all talk about PSH and IPS so often, it's a legislative mandate. It's not, you know, gee, that sounds like fun, or it's a legislative mandate. So we're following through with what the legislature instructed us to do. We've come up with a lot of data. Let me rephrase that. You have come up. The agencies providing services have provided a lot of data that's been compelling for the legislature to continue to move forward, including the 1-year extension that we've gotten. And it's sounding promising that we're going to get the additional 5 years extension past this 1-year extension. So that data is amazing. Providing the services is amazing. Started out with those pilot programs, well into data being collected from the programs across the state. We have data available on our website, which I highly encourage you to read as a part of your learning process. And I highly encourage everybody on this call to be champions related to the service. The more success stories we share, the more knowledge we gain, the more we try to adhere to the 2 principles, the better is going to be the outcome data, and the more likely it will be that FCS will be sustained over a number of years. Next slide, please.
An important part of this whole process is Amerigroup. It's our third-party administrator, and that's who the Healthcare Authority contracts with to roll out and implement these services. What makes up the third-party administrator? It's all you as network providers, and they focus on the service authorization. Now you can do the assessments electronically to send those in. They focus on the claims and encounter tracking reports and RAC codes. And they're also looking at quality improvement and outcomes that they send out, asking for monthly updates, which adds to the data that we collect that we can really show CMS how we're supporting our initiatives and some of the substantial data that's going to help advocate for the next CMS rollout. So we're always talking about sustainability and expanding the network so this can continue, hopefully for the next 5 or 10 years with CMS support and authorizations. Next slide. So an important part of all this for all the network providers is being able to bill for services. So I strongly encourage everybody to go and check in on the quick reference guide for Availity and to connect with the program managers at Amerigroup to kind of work with the system, utilize it and maximize it, because this is the strong component that really provides that sustainability for your program for services. So definitely focusing on the claim submission. There's a process to correct claims if some of the RAC codes were incorrect, and that you can resubmit, and really focus on having your NPI codes as part of this process to do the registration. So Availity is definitely the Medicaid clearinghouse that's going to help you pay for the reimburse for the services that your staff provide. Next slide. An additional part of what Amerigroup offers, they've developed an advisory council. So this is set up on a quarterly basis, and it's a compilation of individuals with lived experience, providers, stakeholders, and advocates across Washington. It's a real important time for you as partners in this process to share success stories, share challenges that we can work through the challenges together, and really look at that sustainability process. Right now, there's an opportunity for providers to provide feedback through the HCA as we get ready for the CMS process for the next 5 years, that your feedback is really valuable. And this is a way to provide ongoing voice and advocate for the services to really establish a program that works for the vendors and ultimately works for the FCS individuals that the supportive housing and supportive employment program works with. Next slide. This is just a recap of the reimbursement rates, and definitely for supportive employment and for supportive housing. If we look at the SE side, that the services are into 15-minute increments with 30 hours of service authorized per 6 months, with a reimbursement rate of $27 a unit. With the SE side, you also can provide services to 16 and above for these services. On the supportive housing side, it's more of a per diem rate model. It's still that 6-month authorization period, but they have a daily rate of $112 a day. So definitely be aware of reauthorization of services to maintain those ongoing services for those people seeking housing or those folks seeking employment. And please note that there's also an exception or rule to provide additional documentation to help with that reauthorization process. Over to you, Kimberly.
All right, so let's talk a little bit more specific about FCS and what it is and what it is not. So this is a targeted Medicaid benefit that provides supportive housing and supported employment services, so finding and maintaining housing and employment. It is not ongoing payment for rent or on room and board costs, although we do have a new TAP program that we can talk about that's going to help with transitioning into housing. It does not pay for wages or enhancements. It's not entitlement. It's really about those support services that help someone find and maintain housing and employment. So I'm going to talk a little bit about the eligibility for housing, and then I'm going to turn it back over to Darren to talk about the employment side. This is a Medicaid benefit, so we want folks to be enrolled in Medicaid. So if you have somebody that you think is eligible but is not quite enrolled in Medicaid, we'd want to start there, get them enrolled in Medicaid, and then they have to have a complex health need. So what that means is they need to have some medical necessity that makes them eligible for the program, whether that be a mental health diagnosis, an SUD, or a complex physical health need that helps or prevents them from functioning successfully or living independently. So those assistance with activities of daily living and living independently. So if they meet one of those, they're on Medicaid, and for housing, they're 18 years or older, then that's the first piece of being eligible for the housing benefit. And then you have to meet a risk factor, and it's only one of these. So this is or, it does not have to be all of them. So the first one is that frequent or lengthy homelessness, that chronic homeless definition from HUD, which is 12 months of consecutive homelessness or 4 episodes in a 3-year period that equal out to 12 months. The great thing about FCS is that if somebody does not have documentation of this duration of homelessness, that they are able to do a self-attestation to show that they have lengthy homelessness. So if they're not part of an HMIS system or haven't really worked with a support service provider who can show this, they can do a self-attestation to prove this for themselves. So that's really exciting, as a lot of programs don't allow for that. The next one is frequent or lengthy stays in institutional settings. So that's skilled nursing, inpatient, incarceration. So if you have somebody rotating through one of those settings twice in a year, they'd be eligible for FCS. The next one is frequent stays in a residential care setting. So again, if they're rotating through a setting like this multiple times a year, that would be someone that would be eligible for supportive housing. Someone that has frequent turnovers in home caregivers. We know that a lot of our folks do have in-home caregivers, and sometimes that doesn't always work out well. They go through them, whether it's because it's not working, they fire them, whatever the case may be. Someone that's rotating through their in-home caregivers frequently through the year would also be eligible for this, for the supportive housing side. And again, you know, this is a lot of times our ALSA population. So the last two that I just talked about, you know, we also work with ALSA in this program. And so if you have a population of folks that's in the aging and long-term care, these might be one of the pieces that would make them eligible for this FCS supportive housing. And then the last one's the Predictive Risk Intelligence System score, the PRISM score, that could be 1.5 or higher. So this really shows that they're using high Medicaid services, like they're in the ED often, they're using high medication costs at a lot of doctor's appointments, things like that would increase their PRISM score. Not everyone has access to the PRISM score. So usually that's a mental health provider, primary care, also providers have access to PRISM. If you're not familiar with PRISM, Amerigroup can look that up for you most of the time for an individual if you don't have access, or you can get it like through an ROI by contacting their other providers to get that. But somebody that has those high Medicaid costs or utilizing the Medicaid often would have that higher score, and that would put them eligible for PRISM for supportive housing. So again, one health need and one risk factor would allow them to be eligible for the supportive housing side. Darren, do you want to go over supported employment?
Sure. Thank you, Kimberly. And again, this is only one of the many risk factors listed here with the same process on the housing risk side. So definitely if somebody is already receiving ABD or HEN, they're eligible for these services. Or if somebody has the dysfunction in the role performance, difficulty obtaining, maintaining employment, they're eligible for these services. So also somebody who's been using supports through SUD treatment or has a history of multiple treatments, they're eligible for these SE supported services, along as diagnostic mental health SUD requiring continued treatment. So definitely a very open and flexible system to get people enrolled and start providing the services they need for stability in the community.
And in case we didn't mention, supported employment allows you to be 16 or older to be part of this program. So that's the difference between housing and employment. Housing, you have to be 18, as you can't sign the lease until you're 18. And then employment, of course, you can obtain a job at 16. So that is a difference in the eligibility requirements for the two benefits. One of the things we really did around this program was want to design it so that there was no wrong door approach to get someone referred. We really wanted people to be screened in for services, not screened out. And a lot of times just getting someone eligible or into the program, referred into the program, can sometimes have barriers. So we really wanted to open that up to allow a lot of different ways to access foundational community supports. So somebody can contact their provider who may or may not be doing FCS, but can connect them to an FCS program and they can get referred that way or directly that way. A family member can refer a participant to the program if they feel that they have somebody that's in need. The great thing is they can literally call Amerigroup up on the 1-800 number that's on our quick reference guide and connect and get a screening done right there for eligibility with the Amerigroup. So we really wanted to make sure there was a lot of different ways for people to access the program. ALSA does their own referral process. So if you have somebody that's working with a AAA or an ALSA agency, they would also be able to connect through their case management program. So, and then of course you can always come to us, or somebody could come to us and we would of course direct them to FCS and Amerigroup to get connected and get authorized for services. We do have the quick reference guide. I think many of you are familiar with that. At some point, we will make sure that in the follow-up, you guys get a copy of that just to make sure you have that on hand. It's a great tool to give out to everyone in the agency and let them know that we're doing this program. This is how you know who's eligible. And please reach out if you have any questions about the eligibility. This is one of those terrible graphics of a referral process. And we always talk about changing this up. I know my whole team's there, everyone on the team's laughing because we talk about this every time. It's a terrible way of showing that we have no wrong door, but there's a lot of ways to access the program. One day we'll update this graphic. I think there's a few out there that are better, but really, again, just being able to access it through many different avenues, right? We want to make sure that people are really able to get to FCS as quickly as possible and get authorized for services. This is the list of FCS managers. So they are partners in this. They're a third-party administrator, like Darren said. So they have program managers as well. So usually when you contract with FCS, you're assigned to a program manager at Amerigroup, who is your kind of your main contact for all questions and assistance. So this is their contact information. I think even now this might even need to be up. There might be one person missing off this list. I can't remember, but this is, I think, the most current one I have that we have as a team that is for the Amerigroup Contact. So if you have any questions and you're not getting connected to Amerigroup for whatever reason, please reach out to one of us and we can help facilitate that connection if there is challenges in any way. We will make sure you guys have this slide and that you have this contact information at your hands. Any questions? We kind of woo right through FCS. Any questions about the eligibility or the referral process for FCS at this point? And you can take yourself off mute, or you can chat in the box if that's helpful.
I don't have any questions.
Okay. You guys are all experts on this part, right? That's the easy part, getting people referred. Okay, well, we do have a 10-minute break. We kind of whisked through that really fast, so I know it's quick to get a break, but we want to make sure you guys have a pause between all the things that we're going over, because we are going to roll into supported employment here. And the next bit of information is going to be a lot more, maybe stuff that you haven't heard or know about. So we want to give you a minute to go get some water, get some paper to take notes, whatever that means. And so we'll come back at 1:40 to start in with the supported employment side of the house and really get you guys informed on the principles of supported employment. See you guys in a few.
Kimberly, got a sec?
Absolutely.
So I don't think this was actually supposed to be for me, but it sounded fascinating and something I needed to learn more about. So I joined. I'm on a healthcare authority list where they invite me to everything. So some are required, and most of the time my supervisor says, nope, you don't need that. I think this is one of those, but is there like a page that explains the foundational community support thing? You know, someplace where I can read more about just really the basics. I mean, I understood everything that we told us about the referral process and the qualifications, but I just need to understand more about the program itself, the fundamentals.
Yeah, so we're actually going to go over some of the fundamentals today, Ben, but if you want to send or put in the chat box your email address, I can connect you with all things FCS.
Okay.
Our fact sheet, our quick reference guide, our websites, those kinds of things will have more information for you.
Perfect.
Yeah.
I will send that to you because I have a zillion things to do today. So,
okay.
Okay.
No
Great.
problem. Yeah, put your email in the address or in the chat box, and we'll get that information to you for sure, Ben. Thanks for chatting.
Thank you very much.
And I was gonna say I don't have access to the chat box all of a sudden, but there it is. Okay. I started to panic for a minute. I was like, where's the chat?
I like your background, Ben.
Thank you.
Perfect.
Yep.
Oh yeah, we've talked before.
Yeah.
Okay.
Yeah, we were in some other training.
Yeah.
Yeah. There's been so many trainings for me. I can't even, it's hard to keep track. So.
Oh, and we like to train people up, I tell you. So if you're getting stuff from us, you're getting it all. That's our thing. So someone told us, you guys are webinaring people to death. And I'm like, that's right. We get them informed. Like they can pick and choose what they attend, but if they want to attend all of them, we're happy to have them.
So I'm a certified peer, and I'm doing a program where the healthcare authority is requiring us all to do the enhanced peer thing. So, which is very exciting. And I've learned so much in the last 2 months. So, yeah.
Fantastic. Well, we're happy to have you, and anything you want to know about FCS, we can meet on the side and talk it up. So I'll send you some information, and then once you read that, you can reconnect, and we'll make sure that you get you get your questions answered.
Great. Thank you, Kimberly.
You're welcome.
All right.
Rayanne, I'm trying to find the way to send it. I can't, the invite's weird because it's from the one I have is from Tony, so I can't resend it out to remind people, but yeah, we're missing a few folks. And I'll share my screen again. I was just trying to look so that everyone didn't have to see my email because it's scary.
Well, I like that tagline. We'll train you up.
We'll train you up.
Put that on a t-shirt.
Someday.
Right. It'll be more fun to do the logo and then put on the t-shirt.
Don't you worry, we got you. Hey, we need to have that. See, I should have been in marketing at some point, I swear.
Well, you are.
I guess technically we are, right?
Yeah.
Some we are, for sure.
I don't always think of it that way, but definitely a marketing exec.
You know, I know everyone's like, they'll send me an email that says, can you come up with a fun little title for my webinar? And I'm like, okay, give me a day, right? And I'll try to, and it's like the pressure gets me and I'm like, I can't think of anything, but then I'll just spew something out of my mouth in the middle of a conversation. They'll be like, that was perfect. Oh my God. Maybe I should have been in marketing in another life. No yawning, Ryan.
No, it like came out and I was like, stop in my head, but it just kept going.
I had a coffee this morning and then I had a break because I canceled that meeting at noon. So I ran to Starbucks. So I'm like, I'm getting another coffee to get through the rest of the day. And they gave me my coffee and then they were like, hey, we made this drink wrong for somebody. You want to take it? And I'm like, sure. So by the end of this, I'm probably going to be like,
Wow.
But I love me some coffee.
I can imagine.
I'm not going to be able to sleep tonight. I'll be texting you guys at midnight like, hey,
Right.
We forgot about this.
yeah, we didn't talk about this. What do we want to do? I came up with an idea for a presentation.
Well, it's the time to do that. So you're right on target with that.
Ugh, I know.
Here's 17 conference proposals, all done by Kim.
I know, right? I came up with 10. I came up with 10. Let's just do them all. The scary thing is 2 of those conferences, they would let us do 10. Like, they're like, what do you want to do? And we're like, let's do some stuff. So got to be careful what you wish for or ask for.
Right.
If you guys are all back and ready to go, we can move forward. I just wanted to make sure we gave you the 10 minutes I promised. So you can give a thumbs up or say, I'm good. It looks like everyone's on mute. So I don't know if anyone stepped off. I love the green. This was a pretty template, Rand. It was a nice change from the HCA blue.
Thank you. We need like a white logo or something. You know what I mean? Like our blue one, or now we have the Pride one. So we can use it. They get covered up by all the colors. You know what I mean? That it limits what you can do with it.
Yeah. Well, I'm hoping to get an FCS logo.
Mm-hmm. That could be awesome.
We're ready for that, right, guys?
Well, for our next 5-year mission, we sure are.
Absolutely. All right, just a couple more minutes. I apologize if you guys hear my dog squeaking with a toy or a chew bone. He's down here at my feet, like making all sorts of ruckus. So I apologize if you can hear him.
We might have a person or two that's going to rejoin us. It looks like a couple of people may have logged off and are going to be coming back on again based on numbers. So. And they've got 2 minutes, so why the heck not?
Right? I was like, if they did leave, like, good for you actually taking a break.
What do you know? Some people do self-care. course, it wouldn't be any of our team, but
I was gonna say, what's
I love
self-care?
me some self-care, Dawn. I don't know.
Yeah, I think you're the best. You're our example, Dawn, about like setting good boundaries and stuff. I told Rayanne the other day, I was like, man, good for Dawn setting those boundaries, man. I'm not good at that. I just say yes to everything. And then I'm like, why did I do that? And
well, it's the funny thing about having been sick for between viruses and sinus infections and another virus for 6 weeks. I just decided maybe self-care was something I needed to do better about.
maybe your body was telling you something. I don't know.
I do believe so.
We have to listen sometimes and not assume we know better than our bodies. Man, I listen to what I say sometimes. I should actually practice what I preach.
You're very wise, Kimberly. If yeah.
Like, oh, what does she know? I don't need to listen to myself. She doesn't know. That's right.
Oh, there it is again, Rand. That one got away too.
No, God dang it. You know, I hold my lips closed.
Yeah, that would be great.
Just sitting here.
Are you
All
right?
right, so we got 140.
All right.
We're legal now.
It's time. So we're going to get started and return it over to the SE folks to talk about supported employment in IPS. Whoops, wrong way. I should start by doing it the right way here.
Yes, the wonderful world of individual placement and support for supportive employment. So Amerigroup Contract for FCS Services is broken into 2 categories. The first one is focusing on those services for pre-employment. And an important part of that is that assessment process to really learn about the individual job seeker and some of their goals and how we can support, validate the goals and move forward together. So definitely encourage folks to have their staff look at the IPS vocational career profile online to really look at that document and look for ways to incorporate that document into your supportive employment intake process. An important pillar of all evidence-based practices is really that person-centered focus for employment planning, to really get to know the person, to validate their desires and do some investigation and learn how to support them through their employment or even through their housing process. A big part of the component for IPS is a really individualized job development and placement process to really focus on job matches that the individual comes up with and how we can go out in the community and find those relationships and those job matches for potential placement. FCS definitely has a component for customized employment, job carving for somebody with some individualized skills and look at how they could be incorporated into the employment process. Benefit education and counseling is so important across both programs in terms of educating people about the benefits they have and how earned income might change their situation, might change their benefits or relationships. Families can be a big part of this. Definitely significant others can be that, or if there's a payee involved, all those people are really important to educate the process and how things might change. Definitely from a needs-based program into earned income, some of the program eligibility might change, some of the benefits might change. I really encourage people to take a look at pathways to employment, pathways to housing, to look at some of the tools and benefit estimator on those sites. Please keep in mind that FCS is built upon medical necessity and the Medicaid model. So definitely if the person is in the car with you and you're doing therapy and interventions along the way, that is part of an authorized service. There's no process to reimburse staff just for driving a car to get to a potential job or potential site in the community. A large focus of the practices is building rapport, getting to know people and building that relationship and really working with them to move forward. IPS also includes supported education, so that could be a component in terms of people getting training, a certificate, or maybe completing their degrees that they may have started at one point to continue that process and then help them through the education process and hopefully into job development after that. So definitely identifying barriers and looking for ways to increase involvement in the community, solution focus priority, and not to negate the collaboration that it takes. It really takes, a team, a village to at times move somebody from the crisis or the situation they're in to a better place that's safe and has a goal process for moving forward. Next slide, please. So the next part of that is also those services that we provide to sustain them in their career, sustain them in school. That could be career advancement, again, certifications or education or some kind of degree process to help them in their advancement. Also, employment specialists play a large role in relationship building with employers. So the SC staff is a great point person for asking for accommodations, or negotiating for accommodations, or implementing some assistive technologies, some tools or time or extra support that will help that person be successful in the position. Sometimes it does take some job analysis for the employment person to come in and kind of look at the position and see what supports might be needed, where the strengths of the individual are, and maybe supports to the individual, or maybe even supports to other coworkers there at the employment site. Job coaching is an essential piece because sometimes people have a hard time learning something new. And as employment specialists, we can come in and help at the job site or maybe off the job site to kind of look through adaptability, interpersonal communication, specifics about jobs to really help the person become more successful on the job. Again, benefits, education planning important before going to work and after obtaining that job. We'll also look at asset developments, follow along supports, transportation, again, with an authorized service, and the option of supported education support. So just want to really emphasize that as part of the evidence-based practice, that it's about employment, but it's about education and gaining additional skills to earn higher income and get a career to support themselves or their family. Next slide, Kimberly. So Donna and I are going to share this part of the process with IPS. So an important part is competitive employment is the goal. It's all the resources, all the time, all the planning is really focused on competitive employment in the communities. This could be short-term employment. It could be working with an agency for temporary employment, but we really want to focus on those employers, those opportunities in the community where people are integrated and paid for the work that they do. Another critical element is really integration with the treatment team. It can be really tough as programs can have some barriers for integration, and IPS really looks at employment staff being integrated with the behavioral health, SUD, whatever treatment teams your agency has, is that they have FaceTime, as well as virtual time these days, but to really get that relationship going so that the employment staff or the subject matter experts, where they can really help people think about potential referrals into the program and come back and share information about some of the success or challenges or barriers that somebody might have in the supportive employment program. So it's opening up that communication and those types of supports that maintain those avenues of communication. IPS actually looks at how many teams an IPS staff works with and limits that to 2 to really improve communication, and that person can really focus those efforts on supporting those different teams and the levels of integration. Zero exclusion, that people have the right to work. And we're really focusing on supporting that. It's not up to maybe a bias I might have, or maybe other clinicians share about somebody's ability to change their situation and grow, that we want to really validate that their thought about employment, provide some support and help navigate, develop a plan for that. And this is a culture change to the organization. It's just not the employment specialist being that champion, but it's the medical providers, it's the treatment staff, it's the receptionists, it could be the maintenance staff. It's something across the agency that really empowers people to support people to move out of the position they're in into more of a position of power, and whether it's obtaining employment or housing for folks. And again, it's that person-centered services that we really want to honor the goals and abilities that people bring to the table and work with those thoughts, those interests, and bring back information to really help educate people to navigate that. Sometimes people change their mind. Sometimes it's month to month, week to week, but to kind of for us to be able to pivot to and understanding sometimes people might need a survival job versus their long-term goal of a career job, and be able to pivot and meet the individual where they're at and get the needs and services that they're requesting. Over to you, Don. Oh, back one. There we go. Don and I are going to split this one up. Oh, you're muted, Don.
Every time I get kicked out and my Wi-Fi is not great, when I come back in again, I'm double muted. So had one undone and not the other. Sorry about that. So benefits planning and education is provided. Darren's mentioned that already. I'm going to reiterate the importance of that. Part of what Darren and I have discussed with benefits planning is it's a matter of doing no harm. Early on, when I was an employment specialist, I helped a person on SSI to get a job. And I thought SSI was the only thing that they had, or it didn't even occur to me that they had other things. Well, they had food, they had SNAP, they had a housing subsidy, they had things that I did not consider and that they lost. And then they quit the job because they became so discouraged because they didn't have enough to cover everything that they ended up losing with that wage. So I'm going to encourage you to consider that now. Build a relationship with a benefits planner right away. If you don't have one in the agency and you want to, consider having one of your staff trained to be a benefits planner. At the very least, have your employment staff and perhaps other staff do some training on benefits planning. Darren mentioned the Pathways to Employment website. It's got 4 2-hour webinars that are on your own time. You can look at them whenever you want to, but they give the basics of benefit planning so that you do no harm. Darren's brought up a story of an individual recently that owed tens of thousands of dollars to the Social Security Administration, which they're going to be paying off to the tune of, it was either $50 or $75 pretty much for the rest of their life per month in order to get that paid back. We don't want to see overpayments, so benefits planning is huge. Amerigroup maintains a list of certified benefits planners that you can contract with, and that's for a fee. You'd have to pay them. But Amerigroup also has had a scenario where if you pay for someone to do benefits planning, there may be a reimbursement for that. So get some training from your Amerigroup program manager in order to make sure you're up to speed on that. But recognize that from the beginning, it's an important thing. I've seen a lot of career profiles, and it has one small section on benefits planning in it. And I've seen staff write, didn't need benefits planning, they only had SSI. Didn't need benefits planning, they only have medical or Medicaid. Anybody on your caseload needs benefits planning. And I don't really care whether it's supported employment or supportive housing. It really is that do no harm kind of scenario. Supportive housing staff want to know as well kind of what their subsidies are, and that's probably going to happen, but what their subsidies are, housing subsidies in addition to their medical, or whether they're on SNAP or various other things, so that they can collaborate with the supported employment specialist to make sure that that any wage that they get either supplants all of those things if they're intending to get off the system, that they have money in excess of all of those different benefits, or they maintain, part-time employment if that's a need. Rapid job search doesn't mean rapid job obtain. I know there's been heartburn from various folks about the rapid job search idea. The intent there is for either the individual or the employment staff, or a combination of the two of them, to get out in front of an employer within 30 days for highest fidelity, but within 30 days of them having the first contact with an employment specialist. I apologize, I evidently walked out into a cobweb during break, and I've now got a couple of little spiders crawling on me. Hopefully little. So I'm sorry. So that rapid job search, it's about respect. The person said they wanted to work. So let's get them in front of an employer and show them that we respect that decision and we're moving that direction. It could be an informational interview if somebody's not entirely sure what it is that they want to do, but to get them in front of that employer that they think they're interested in so they can ask some questions and maybe get a tour of the business. It can be an actual interview. It can be getting in front of an employer so that a person gets to practice the opportunity of being in front of employers. It could be a variety of things, but it is rapid job search and not always rapid job find. Now, if a person comes to you and they say, I'm going to get kicked out of my housing in 30 days, I got to have a job right now, it could in fact be rapid job search. It could be helping them to find a job as quickly as is possible, and potentially not the long-term job they want to stay in, but maybe a survivor job with a longer-term goal of whatever the career is that they might want to do. Systematic job development really refers to the fact that sometimes employment specialists get lucky and the first employer that they contact on behalf of a person is the one that hires them. For the best job matches, for the ones that are hopefully long-term and ones that really fit with the person's skills, abilities, and interests, you need to get to know an employer and what it is that they need. You need to get to know the person on your caseload, obviously, in order to figure out, kind of what jobs to refer them to. But equally important is getting to know those employers. And I know that you've all found over this past couple of years, virtual meetings don't build relationships in the same way as face-to-face meetings do. So when they talk about systematic job development, it's intended to be face-to-face, building relationships so that you know the employer and so that they recognize that you're a person of your word. That if you've promised to do something, you follow through and you observe that commitment. Those are the ways, and I'm not telling you anything you don't know, but those are the ways to build relationships with employers the same way as you do with other folks. Time unlimited supports. I've done supported employment for a bunch of years, including in sheltered workshops, which are not a healthy environment, very honestly. And including, the scenario where we used to place people in a job and then kind of say, you got your job, see ya. That doesn't work either. The intent with time unlimited support is that, frankly, any of us can use support at some point in time. And potentially, hopefully, we have those support people in place that we know we can talk to. I can talk to anybody on my team when I'm having a bad day and I know I'm going to get support. The folks on our caseloads maybe have burnt enough bridges that they don't have people to support them, and perhaps they haven't built those relationships at work yet. So that employment specialist ends up being incredibly important in helping them to work through the bumps that are going to occur on jobs. We all recognize, having been in probably various different jobs, that there's a honeymoon period. So part of the idea of it being time unlimited is to get you past that, get the person past that honeymoon period, and maybe into that period of time where they start to have some challenges at work, so that you can help them to figure out how to work through those scenarios. Next slide, please. So when IPS says the 8 principles, they sort of fib. There's 25 in the fidelity scale. There's 8 that kind of draw some of them together. But I've always found when they say 8, these are things that 8 doesn't necessarily cover. IPS says caseloads of 20 people or fewer for highest fidelity. The scenario is that if you're going to provide that time unlimited support, if you're going to help people with job interviews and talking to employers and various things, a caseload of 20 is the likeliest for an employment specialist to actually be able to provide all the services to people that they should be providing. I will say for highest fidelity, and Darren, you can plug your ears if you want to, the agency that I worked for, they're very good. When we had a fidelity review, we had caseloads of higher than 20, I will say, by quite a bit. We'd shrunk them down, but then determined over a period of time that a caseload of 25 was actually going to be instrumental in us bringing in enough income to keep the program viable. We recognized we're never going to get a 5 on that particular fidelity item. We were always going to get a 4, and each of the items has a 5-point scale as far as where you may be scored. We actively decided we were going to keep caseloads of 25 because that was most financially viable. The nice thing about Fidelity is that, unlike an audit, it doesn't say you have to fix all of these things, or we're going to take money away, or we're going to close your doors in 30 days, or we're going to, take your license away, or whatever it is. Fidelity says, here are the items which, if you improved upon, you're going to improve your outcomes, meaning more people are going to get jobs. It's proven. This isn't something we're guessing at. There's lots of data that shows that it's accurate. But agencies get to decide which items they will in fact approve upon after they've had a fidelity review. Collaboration with DVR. I know that DVR is an order of selection, which is a fancy way of saying the waiting list for those of you that may not be familiar with that. If it goes as it has done in years in the past when they've been an order of selection, at some point in time they'll work their way away from that. I'm hoping that's the case. Over the period of years that I've done supported employment, I've seen order of selection, I think 3 times. This is the 3rd. In each case, they've worked, and I see Darren nodding. In each case, they've worked their way out of it. So don't feel like this is a forevermore kind of thing. Hopefully it will not be. And you don't want to be in a position of not collaborating with DVR. They are the state recognized agency for helping people with disabilities to become employed, which sometimes includes education, which sometimes includes uniforms if that's what a person needs for their job. In the past, and I'm not sure if they still do this, sometimes it included car repairs or gas money to be able to get back and forth to a job. So plus it includes that the DVR counselor is a trained professional who's a great resource related to, this person isn't succeeding. Do you have some ideas as to why? If you follow Fidelity the way that it's written, and that DVR counselor is part of vocational team meetings, and you're staffing the case of somebody that maybe isn't open with DVR, but the counselor is there, they will still provide you with feedback in regards to, have you tried this or that? Or so they're a resource to be used. In addition to the fact that if a person's referred, and I've heard kind of different stories depending upon different regions for voc rehab, but if a person's referred, they can get benefits planning while they're waiting for that approval process as far as whether they're approved from DVR. Order of selection also does not mean that no one gets opened up. They are currently serving people, their terminology, people with most significant disabilities and significant disabilities. So there are people still being opened up to DVR cases pretty quickly. Employment specialists provide only employment services is one of the items that IPS encourages. I'm going to tell you a personal story that underlines that. Years ago, maybe 15, maybe 12, something like that, the state of Washington had a 1915 Medicaid B3 waiver, which allowed Medicaid to pay for supported employment services. It was taken away. And my understanding at the point in time that it was taken away was that it was not statewide, was part of one of the issues. You can count on the fact we've worked very hard at making sure that FCS is statewide. I'm trying to remember what there's another issue that's not coming to me right now. The agency that I worked for, thankfully, decided not to do away with the supported employment program. Instead, what they did is said, you're going to be case managers and your specialty is employment services. I can tell you from my experience and that of my colleague who was doing the same thing. When somebody came in and they were in danger of losing their housing, or they just lost their housing, or meds were stolen, or they didn't have any food on their table, or they were in trouble with the police and needed some, kind of guidance or assistance, those are the things we focused on. It was a rare circumstance to actually focus on supported employment. I do know that some agencies, in order to get started, are having the same person do supportive housing and supported employment. More power to you. I hope you will consider over a period of time, when you're financially able to, shift staff so they're doing either supportive housing or supported employment. I will say, in having done fidelity reviews of agencies where they do both, rarely does supported employment actually get the full attention that it requires. They have that principle for a reason. If you have more questions or want more information about that, I'm happy to provide it. But I'll reiterate, that's one of the principles for a reason. And I've seen actual how it may not work in agencies. Now, that's not all. And if you figured out a way to do it, love to hear more about it. But just make sure if you're doing both that the person really does that 50-50 split, and it's not 75-25 or whatever that might be. Employment specialist is a vocational generalist, just as kind of a fancy way of saying that once they're assigned to supported employment, that individual does all of the different aspects with the person. They do the vocational intake, they do the job search, they do the job coaching, they do helping with resumes, part of which is to enable the staff person to get to know the person as well as they may, to spend that time with them. Part of it is so that the person doesn't have to tell their story multiple times to multiple different people. Employment specialists spend 65% of their time in the community. Hard to help people find jobs if you're not out in the community and talking to employers. I know we've had pandemic restrictions that have been pretty huge, and it's been incredibly hard. And I have, so many kudos for the agencies that kept going, figured out ways to do it, even though it was virtual. As pandemic restrictions lift, the intent is 65% of the time in the community. That's also in part to help a person who may have been home for a long period of time, whether it's pandemic or not, to feel more comfortable with being out in the community, to help them establish that kind of comfort level and to change their days so that they are actually spending time out in the community, because that's likely going to be what they do when they find a job. It is also possible for individuals to be self-employed, and that's something that we can do, we can discuss in greater detail at a different time. Discussions around disclosure happen more than once, including pros and cons of disclosing, are based on individual choice and are documented. You've all heard, if it wasn't documented, it didn't happen. And the intent of disclosure is potentially to do it a little differently. I've been through fidelity reviews on the being reviewed side of the table. Had a fidelity reviewer early on that I knew quite well, and we were talking about disclosure, and she asked, how many people are allowing you to talk to employers on their behalf? And I said, oh, almost nobody. She said, then you're doing it wrong. I know she wouldn't have said that had she not known me so well, but she was right. The intent with disclosure is that you're not sharing a great big secret, because hopefully staff is not sharing the person has schizophrenia. If I say schizophrenia to most employers, they're going to run in fear. Why would you do that when you're doing job development? So you might talk about a person having, or staff may talk about a person having problems with organization or difficulty with being distracted. And here's how they cope with those kinds of things. Everybody has strengths and weaknesses. Every employer out there is going to ask you, what are your weaknesses? And you better come up with one that you've also resolved. Same kind of thing here. So we teach, when you discuss disclosure, you don't share the disability, you share what are some of the issues a person has had that they've worked their way past, like we all do. Very much based on individual choice. We were talking earlier about job development in another training, and discussed the fact, and it was actually a staff person I supervised that gave me this aha moment. If a staff person who's an employment specialist goes out and talks to an employer and says, I work for this great agency that serves people with behavioral health issues, and we do this and this and this, and the person on their caseload has said they can do that, great. What if the next person says, I don't want you to share my disability? But that staff, the employer knows that who you work for and what it is that you do. You've already outed that person. So theoretically become a little less effective in that scenario. So be aware when your staff are talking about disclosure, it's not a wide open thing. It's less is more. It's document what you have discussed. It's document per circumstance. Somebody wants to be a certified peer counselor, they're going to have to address in their interview with a behavioral health employer that they have lived experience, or they're not going to get the certified peer counselor job. On the other hand, if they're going to work for Amazon, do they really want to bring that up? So it's a per employer kind of discussion. It's not one and done. Assertive engagement occurs in conjunction with other colleagues and natural supports if someone ceases to attend services. Sometimes, you know, the employment specialist is the person that gets along incredibly well with someone. Sometimes it's a case manager or a therapist or a housing staff and so this encourages collaborating with the staff person that is most likely to see the individual that ceased to show up, and to see if you can get them involved in helping to reconnect. Family members too. Important to, if the person agrees to it, to connect with family members so that if they have difficulties, you know, coming in on a consistent basis, perhaps they get that level of support from a family member. I'm just going to ask, just because I'm interested, and we're sort of at the end of this piece of IPS, any questions? Do those things make sense? Yeah, I see Paul, I see Jeff nodding. I truly think both permanent supportive housing and individual placement and support are based on common sense. You know, they really are. They're based on things that work, but those things originally are, you know, when they started developing the programs, they're based on common sense. If you have questions, if you want training on things like job development for your staff in a kind of more intense fashion, we can do that. I will say, when we used to do face-to-face job development training, we'd do the book piece of things in the morning, and in the afternoon, we'd go out with the staff that attended the training and observe them doing job development and have them observe us. And then we'd critique each other in regards to what could have gone better and what went well and how to feel about it and that kind of thing. So if that's something that you would find useful in the future, please let us know. Thank you for putting up with me yammering on.
Thanks, Don. I just wanted to add that this is a process of implementation. So definitely take some of these kernels so that you can start changing the culture early as we look at other elements to implement throughout this training.
Thank you. We do have 10 minutes set aside for a break. I'm curious to know if you guys want to power through, if we want that 10 minutes. What are you guys thinking? Otherwise, we're going to roll into supportive housing. The folks want a 10-minute break?
I'm good. I don't need a break.
Okay.
Yeah.
Keep on going.
Push through.
Okay.
Yeah,
Keep on going.
Let's move on then. Let's do this. Okay. So we are going to start talking about supportive housing, and you're going to see that a lot of this is very familiar, as it very much emulates what supported employment looks like, the principles, and that's why, you know, we really believe in these principles and the fact that they do go so hand in hand. So again, we'll have a moment for you guys to ask questions as we go through this, but I'm going to go ahead and get started. So I like to share this slide because, you know, even a decade ago, we were so far from providing supportive housing services through Medicaid. And so this slide, this picture of supportive housing being prescribed, or a housing unit being prescribed, is so much more a reality than it was years ago when I first started housing. And so I love sharing this because it just shows how far we've come. Even 10 years, which sometimes can feel like a long time, and other times like a flash of it, right? But really, we've come a long way in housing, and the fact that we are able to really support people in finding that housing, and that it's really part of somebody's well-being, right? That's what these two benefits are all about, is those social determinants of health, and really ensuring that somebody has the support in those things of finding and maintaining housing and employment, and keeping them in stable housing so that they can do well and really focus on moving forward. And so I love sharing this because it's just so close. We're so close to being able to say, hey, you need a 1-bedroom apartment, right? And that's really what we're doing here. And so I love that, and I'll probably continue to share it till people get sick to death of that. But it's really so cool how far we've come in the world of housing and employment, really. So as Dawn and Darren shared, we have an evidence-based practice that we really follow with foundational community supports. And so in 2013, we were legislatively mandated to really do these best practices or promising practices, right? To ensure the outcomes that we so hope for with the folks that we serve. And so really being able to follow this, what I like to say, recipe that allows us to kind of have a guideline, like a roadmap of what we should do and how we support people to ensure we're getting those outcomes. And so I always use the analogy of the chocolate cake recipe. Some of you have probably heard this, you know, those of you from Consistent Care who have been through a few of our trainings have heard this, but you know, that chocolate cake recipe, you got that award-winning chocolate cake that you've tasted and you're like, wow, I have to have that. That's a recipe I need to remake, right? And you get home and you start messing with that recipe. You make it exactly how it's set up, right? You follow the directions exactly, you're going to get that award-winning cake. You're going to get that outcome that you expected from it. Now, sometimes we mess with our recipes a little bit, right? We add a little extra of this, or maybe add some food coloring, and suddenly you've got red velvet. Not quite chocolate cake, sort of, but not quite the outcome we were expecting, right? So just as with these principles, with this recipe, you follow it to a T, you're going to get the outcomes that we hope. And sometimes we have to mess around with it a little bit, but the closer you get to that recipe, the closer to the outcomes you're gonna reach. And this got mentioned before, but also we've been using these evidence-based practices in our supportive housing programs at the state for at least a decade. I would say, 11 years, actually, more than a decade now. Wow, time flies. I started actually in the Porch program 11 years ago, providing supportive housing services to the same population that we're actually serving in FCS. Porch was actually the beginnings of the white pages for what we do in FCS today. We were serving folks in their community to keep them out of going through the institutional settings over and over again, and really serving them in their community and helping them stay stably housed. And so we started following this fidelity model, this evidence-based practice during those days, and really started learning about how that worked and kind of tracking the outcomes. And then we also moved forward into some other pilot projects like Bridges, who was doing a similar thing. We were working with folks targeting certain populations to use these principles to support them in their community. And we continue to do that with our HARPS program, Housing and Recovery Through Peer Services, and also FCS today. So this is something that we found is very, very beneficial in what we do with folks. We are seeing those outcomes, we're tracking that data, and that is why it got chosen for FCS as we move forward into this benefit, as we know that these outcomes do exist, and you guys providing these services is the proof in the pudding for that. So we just like to show kind of that this has been something that we've started as a pilot really, and slowly just saw the outcomes just get better and better. And so we started utilizing them in all of our programs, and actually the legislation was like, hey, we see that and we want you to continue to do that work. I'm going to turn it over to Rayanne.
So this next group is really about what are the services that Amerigroup, that you bill for that you'll get reimbursed for, or you can get, I guess, bill for. So all of that pre-tenancy stuff, all the things that, all the work that it takes to get someone into housing, that might be getting an ID, social security card, what's your documentation? Do you have an address? All of those kind of pieces fall within that pre-tenancy kind of designation. So, most of everything that anybody's going to do in housing is going to pretty easily fall under these categories. But some of the work that we do is helping agencies really figure out, well, we do this one thing a lot, and I'm not sure if this fits, right? So if there's any of those questions, we'd be happy to walk through that with you. But all of the assessments, right? Like, where do you want to live? What kind of housing do you want to live in? Do you need accessibility? Have you ever been housed before, right? Getting all of those questions to make sure that we get them to the housing that they choose, that they want. But we also are informed, and they're informed through the whole process. All of the developing of community, right? Getting those services really on the team of that individual, to make sure that, again, that the housing person isn't the end all be all of everything, for the human that we're serving, right? Historically, that kind of is how housing worked, right? Like you are a housing specialist and you do all the things and hope that you can kind of half do them all pretty decent, right? And so part of that evidence-based practice and the low caseloads and all of that is to say, we're not meant to be good at everything under the sun. We're meant to be good at connecting to other agencies, other informal and formal supports to get them on the team for that individual. It's not meant to be us to kind of save everything, because we know we go on vacation, something happens, right? We just can't be that person. So all that work, getting those community services, working with landlords to find landlords, right? All of those calls to say, hey, will you take my person? What does that look like? All of those services are billable. Of course, what we want to see is that you're tying it directly back to that treatment plan or that case plan, housing plan, whatever you call it, and that it's clear why you're doing what you're doing, right? And that it's directly related to their housing. So those are kind of some important points when we look at like, what is your staff doing to get someone housed, but just make sure that it's tied back to that treatment plan. And then to Dawn and Darren's point, right, that financial skill building, the benefits support, how's your income going to change? You need to tell the housing authority if your income changes over $200, right? The participant needs to know that so that when something happens, they don't have to do the reimbursement thing and get themselves in trouble with housing, right? So pre-tenancy, and then you can go to the next one. Thank you. And then post-tenancy or tenancy sustaining services, right? Very similar list of things because we know once someone gets into housing, it's not like, sweet, yeah, we're done, right? Like that's not how it goes at all. There's still a ton of work that can be done, often more than maybe, or more diverse than we originally had when we were looking for housing, because we're pretty pointed, like housing, 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 that's what we're gonna do, right? And then when we look at what's it gonna take to help you sustain that, right? What's it gonna take to make sure that you have every opportunity to be happy, healthy, and live in your own housing? So these are the things that you can bill for. The one thing that I like to call out is the increasing ADLs. That's not us like managing someone's medications or helping them up and down out of a chair to make sure that they can, do those activities of daily living. It's really us connecting to those places, getting them the assessments, what's needed. Sometimes that might mean, right, they've never washed dishes or they've never cleaned before. So I'm gonna wash, you're gonna dry, we're gonna put them away together, and the next time you're gonna do more of it, right? That kind of continuous skill building are those things those are the skills we need to be able to sustain housing. And it's really the housing specialist job to either get folks on the team that can help with that, or they help build those skills. And then of course the landlord liaison work. So we know that folks might not know exactly how to go, and they might get notices, right? 10-day comply or vacates, or the landlord might call us and say, hey, we have a problem, or I'm worried about this person in that unit. So all of that work when you're working with a landlord, as long as it's tied back to the individual that you're serving, those things are billable, right? When we're doing kind of housing searches and we're looking for landlords, or maybe we're contacting multiple landlords because we have a whole caseload of folks, that kind of landlord liaison work is not billable. But if you're talking to a landlord specifically for one person, and you can tie it back to that one person, that's a billable service for FCS. Go ahead and go to the next one, Kimberly, thank you. And then just a reminder, right? We're talking about, the group of you here are leadership, and you have power to make these decisions. And often a lot of the information that we're going to get is through assessments, right? So it's just some friendly reminders that, and as you know, right, assessments can be incredibly powerful tools, but they're also really, they can do a lot of harm, right? If we're doing assessments, we're asking all these questions and we don't really need to know the information, or maybe we don't tell the participant, what do we do with that information, right? So we very much would encourage you that the participant should know, why are you asking, or what are you asking for? What are you going to do with that information? Is it data collecting? Is it to make sure that your staff is trained correctly, right? I used to tell mine on that just incredible SPADAT, if any of you do that, right? Like some of those questions aren't great, but one of the things that we would do is say, okay, So I've seen every month I would run that data and say, okay, I've seen an uptick in folks who identify with alcohol abuse disorder, right? And I'd say, when was the last time we had a training about that, right? Like, so you can use these assessments in a really powerful way, but they take time. And then we want to make sure that we're responsibly conducting those, and make sure that your staff know that and your staff are trained, how to do those assessments ethically. Go ahead, Kimberly, next one. I think it's back to you.
Thanks, Rayanne. So now we're going to talk about the principles of supportive housing. So again, like I said, we have 7 principles of supportive housing that we really follow to ensure we're supporting folks the way that we hope to get those outcomes, and really gives us a guide, a roadmap to what kind of services we're providing as a program. And so I'm going to go through each one, and some of you may be really familiar with these already, but we'll just kind of review. The first one is really choice of housing. So it's really choice in general. So for me, I think choice is paramount in all the things we do, whether we're doing employment or housing or just, peer support, whatever it looks like. We want to offer choice to our participants, allowing them to choose where they live, what services they receive, who they get to live with, what that looks like, really empowers the individual to take control of their own lives and really feel like they have control over what's happening in their world, right? And so allowing them to choose where they live a lot of times shows it gives them the ability to really buy in a little bit more, and they tend to be a little bit more committed to doing well and taking care of their place. They, if you're just placing people into units, a lot of times we find that without that choice, they're just kind of getting put somewhere and they don't do as well. They're not as committed to it because it's not something they chose. It's not something they love. It's not the home that they want, right? So really being mindful of when we are doing those kinds of assessments or having those conversations to talk to an individual about what they want and need in housing. It isn't just about what you need. Let's check some boxes, but really, what does home look like to you? Who would be in that home? Who's going to be living with you? Where does that look like? What neighborhood feels safe to you? So those things are really important in thinking about choice and how we're supporting someone in housing. Allowing them to have multiple units to choose from, allowing them to decide who their composition, what family looks like to them, and then going from there to support them and finding the best we can to meet those needs. Also, are we allowing them to not choose places? There's a lot of times where we have this, we throw these policies in place that really kind of put up additional barriers to supporting folks and telling someone, well, you get to choose 3. And after that, we've decided you probably don't want housing and you're going to go back to a list, right? Instead, continuing to support them, even if they decline 5 different places and then go, well, I noticed you're not choosing these 5 places. Do we need to revisit why that's happening? Or is there something I missed? Maybe they're getting kind of cold feet to committing to that housing because it's becoming really real. And that can create some real anxiety for folks who have been homeless a really long time. So really thinking about having those conversations and saying, hey, I noticed we've been looking at an awful lot of places and it seems like some of these aren't, you don't really seem to find one that you like. What can we do to find that place? Is it that we need to look at different things? Sometimes after looking at units, people are like, yeah, that's actually not what I need. Sometimes they just change their mind in general, right? We're allowed to change our minds. And then other times, again, like I said, sometimes it's about, this is becoming really real. The commitment's getting a little too close for comfort, and maybe having some conversations about how we can support them and maybe slow our role in serving them and go, okay, let's step back and think about what we can do to get you feeling a little bit more comfortable with the idea of signing a lease or moving into a place and having to pay bills and those kinds of things. So choice is really paramount in a lot of that. The next one is separation of housing and services. And this really comes into play with what is our role as housing specialists and what is the landlord or housing management role? A lot of times these can be really blurred and overlapped, especially if an agency owns their own housing, right? We can get really caught up in everyone just kind of does a little bit of this and a little bit of that. And suddenly the participant is very confused at who is there for what purpose, right? Who do I go to when I'm having a housing issue? Who do I go to when I need to pay my rent? So really thinking about in our policies, what is the role of the housing specialist? They're really there to support an individual, be there to, help advocate to the landlord when they can't pay their rent, helping them figure out, maybe going and getting a money order, those kinds of things. But our role is not to actually collect the rent. Our role is not to, give evictions or notices, right? We're there to support the individual when those things happen and be that kind of mitigator in between with the landlord, and the landlord's there to do those other pieces, right? And that allows them to really know who they go to for what reasons. And it also, if you don't think about, that overlap can really affect the dynamics of our relationship with our folks, right? They don't want to tell their landlord that they spent all their money on a brand new phone instead of their rent, right? That's not an easy conversation to have, but they may feel comfortable telling you because you're going to help them figure out how to get that rent paid. So having that dual role can really make it unsafe or make them feel unsafe in telling us everything that would be helpful in supporting that individual. So really thinking about how we're defining our roles when we're thinking about policy and procedure, when we're thinking about job descriptions. And again, a lot of times this comes into play mostly when agencies are doing both the housing side and the support side, but it can even happen sometimes when we get really comfortable with certain landlords. If we're just doing the housing side, sometimes we start, well, I don't mind running that there, or, we shouldn't be holding keys for individuals. Those are all things that wouldn't be part of the housing specialist side of the house. Okay. So really thinking about what that looks like. And if you ever have questions about how to determine, Rayanne and I are here to help support you in thinking those through. We have job descriptions. We can help you think about, what role is what, and really help you define that if you need support in that way. Decent, safe, and affordable is that three-prong principle. Really, the first one is, are they going into decent housing? So are we looking at the housing before someone moves in? We know that HUD does, right? They do a housing quality standard before they're willing to pay rent. TBRA vouchers do that as well. So are we looking at what housing people are going into and having that conversation with them to say, hey, I know you have your name on a list for Section 8 voucher. And if you move into this place and it doesn't pass an inspection, you may have to relocate once you get that voucher, right? Or, hey, this doesn't have some things that maybe qualify as safe or decent. Are you willing to live in a place that doesn't meet these qualities, right? So sometimes it's about having those conversations and finding out what they're okay with and what they're not, and how that may affect rental assistance or moving on next to the next place. So really having those checklists, and it doesn't have to be, you don't have to be an official HQS inspector to do this. We have these great checklists you can use to walk through with a participant to see if something would pass the HQS or the housing habitability standard inspection. And then you can say, hey, now we have this. We can go to the landlord and advocate for these repairs, or we can just say, hey, are you okay with living in a place that doesn't have these things? And if they're paying out of their own pocket, don't have rental assistance, they may choose to live in a place that doesn't meet these HQS or HHS inspection standards. But we document that and say, Joe decided that he was okay living in this unit, even though it doesn't pass HQS because of this, right? And we can document why they chose that. We keep those in our file so that we can help advocate for that if we need to, and refer back to them if necessary when we're speaking with the landlord or a rental subsidy program. So these are really important in that way, that it offers a lot of different ways to advocate for our participant and ensure that they are set up for success in their housing. The next part is safety. Are we asking a participant what feels safe to them when they're moving into a place? What feels safe to me may not feel safe to them or to you, right? We all have different, feelings about what's safe to us. Maybe we're looking at places in a neighborhood where they actually used to actively use and they're trying to stay in recovery. Maybe they had some domestic violence happen or trauma happen in a neighborhood, and we don't want them to have to go home and revisit that every time they go home to their apartment, right? So thinking about what feels safe. A good example of this is you have somebody go look at an apartment on a Tuesday afternoon, and they're like, wow, it's really calm and serene and quiet, and I'm really excited. I want to move there. They move in, and Friday night is like the wild, wild west in that apartment, right? And suddenly they're like, whoa, I had no idea. This does not feel good. So really thinking about when they're viewing those apartments, maybe checking it out a couple times before they make those decisions. I know sometimes we don't have that time, or sometimes people are just in a hurry to get housed, but having those kinds of conversations to think about what safety is for them, and thinking about how we're addressing that to support them and moving in somewhere that they want to be and that will feel good going home to. And the last part, and we know is one of the main parts of housing, right, is that affordability piece, finding affordable housing. What does that mean? How do we do that? Well, a couple things, right? We want to make sure that we're trying to do our best to connect them to rental assistance, which sometimes means building partnerships in our community with those folks that have vouchers to share or to support our folks, right? So that may mean doing some footwork and having some meetings and really building that rapport with another agency that really is the holder to the key of those subsidies, right? So really getting people connected, whether that's through coordinated entry, through those partnerships. You really want to get people thinking about how are we going to afford rent long-term, right? That sustainability piece. The other part is, are we talking about supported employment to these folks? That is really the true way to sustain housing long-term, is to get them thinking about how they can make their own income and change kind of the game for them in being independent, right? So we know Social Security is not going to help them move out of poverty, right? It's very, very limited income. And some of these programs that do support them short-term are not going to be there long-term for them. So really thinking about that long-term sustainability really is like, what can you do for work? And so that's where the supported employment, supportive housing really goes hand in hand. Get them connected, start planting that seed early when you're working with somebody, start having that conversation. A lot of times that's not always an instant, like, yes, I want to work. A lot of times you're going to hear, I can't work. I don't want to. I don't see that in my future. There's no job that's appropriate for me. But really thinking about, hey, I can have an employment specialist come and chat with you and just talk to you about what supported employment means. There are so many non-traditional ideas of work that you could maybe think about that would be appropriate for you and your ability, whether that be because they have a disability, they feel like they can't do it because of anxiety or some kind of, one of their mental health diagnosis, but really talking to them and showing them there is a world of choices in the type of employment that they can get connected to and that they can have support through the whole process. And so really planting that seed and watering it and talking about it every time. And sometimes that may take a couple days and sometimes that may take a year and a half. I have lots of examples where I just kept, hey, by the way, what about employment, right? And eventually I've seen people change their lives. And actually, I've seen people get jobs that they made more than I did in direct service after working with supported employment. And really just, it was a game changer for them. So don't be afraid to have those conversations early, and don't be afraid to continue to have them. It's not being pushy, it's just checking in, right? Where are you at with that? What do you think about that? And sometimes it's just bringing the employment side in to say, hey, I have somebody I want you to chat with, and maybe they can, you can ask some questions and just kind of do that kind of exploratory idea of maybe going back to work or getting, and maybe they start with just kind of doing some volunteer at first if that's all they want to do, just to see if they can show up for a commitment every day. And maybe it's that, hey, yeah, I want a job, I just don't know what to do or how I can do that. So really getting involved to help them sustain that long-term rent is going to be so important, because we know that there is very few long-term rental assistance programs out there, and we want them to be able to feel like they can really independently live on their own. The next piece is housing integration, and this has got different pieces to it. We really talk a lot about what kind of housing are we housing folks in, right? So you hear scattered site a lot, permanent supportive housing out in the community where anyone could go rent that apartment or that duplex. Those are really great for folks. It helps them build their community on their own. It helps them build natural supports that maybe they didn't have before. A lot of times we find that we house someone in the community and it's down the street from a church, and they start attending that church, and suddenly they have a job opportunity or a new book club to join, and now they have friends that they didn't have before, right? And then there's other folks that want to live in non-integrated spaces. Maybe it's because they want to go into recovery housing or subsidized housing that requires you to have a mental health diagnosis, right? That's okay too. We want to support them in the choice of where they live, but are we integrating them in the community either way? So if you do have somebody that decides they want to live in Oxford housing because they need that support and that's what's important to them, and then what else are we doing to get them connected to their community? Are we talking to them about what other things they want to do? An example is I had a participant who really, really isolated a lot, right? She wanted friends so badly, but she always said, there's nobody I've met that has the same interest as me. She went to classes at her mental health facility, and that was great, but all the same people, they all lived next to each other. In fact, there was probably like 7 of them living in the same complex. What is that? I want people that like art like I do, Kimberly. And so, eventually I got really thinking about that. Where can I connect her to people that might enjoy that, where she hasn't had the opportunity to meet them or become build friendships. And so We got her connected to a once a month art walk that we did in our community, right? And suddenly she was attending that every month and started making friends that way and building a community. We also got her thinking about how she was going to sell her crafts. That was part of the way of getting her thinking about employment, right? Is that, hey, you know, you're really crafting, you're making these really awesome things, and you could totally sell that. And so we got her connected to an Etsy account. And then suddenly she was getting more confident in what she was doing. And the next thing you know, she's at a farmer's market selling her stuff. And guess where she was making friends and a community on her own, was at that farmer's market with other crafty folks, right? And so really thinking about how we're integrating folks into their communities so they can build those natural supports and really build their own community. You ask people when you serve them or meet with them, do you feel like you belong? And a lot of times they'll tell you, no, I don't feel like I belong in this community. And so we really want to change that dynamic and say, here, yes, I have friends, I'm part of this community, I'm involved in this, and this. That's what we hope for our folks, right? And so that's what we're here to do, is build that, whether they decide to go in non-integrated housing or integrated housing where they're kind of building that on their own. We want them to have those opportunities. The other piece about integration that I'm going to talk about is the fact that we can become really complacent with working with the same few landlords, right? They're easy, they like us, they call us when they have a place open, and suddenly, like I said, you have 7 people living in a 10-unit place. That's great, they're all housed, but now they're all neighbors, and maybe they all get services in the same place, and 2 of them brawl outside every day at art class because they don't like each other, and now they're neighbors. You can imagine that's a fun thing to manage, right? And now we're burning out our landlord with landlord issues, right? Tenant issues. And so we want to be mindful of not just leaning on those landlords that are so easy to work with, but really building and continuing to build our landlord stock so we can offer lots of choices where we maybe aren't living again with all the same people we attend our recovery art with or go to SUD treatment with, right? We want to make sure that we're allowing them to really build their own community as opposed to kind of forcing them into the same group they already engage with and maybe don't necessarily vibe with very well. And we want those landlords to want to continue to work with us. So we certainly don't want to burn them out and do that also, because not sometimes, all the time, our landlords are gold. I come from a small community, so you don't want to burn bridges. A burn bridge means it's done. Like small communities, it's hard to build additional stock, right? So you want to save those landlords and make sure we're doing what we can to support them as well. And part of that is making sure we're not overloading them with too many folks in the same units, same building. So there's a couple different facets to integration, but it's really, really important for that community to support them in building their own. Because again, we can't be somebody's 24/7 emergency contact when we work 8 to 5, right? What happens on Saturday at 6 p.m. when they can't reach us? They need to have support outside of their professional or formal supports. And we want to help them do that, whatever that looks like for them. Rights of tenancy. So this is a big one too, because, you know, we want folks to, again, have full rights of tenancy as much as we can, as much as they choose, right? So going into a unit where they're signing a legal lease in their name that has the same rights as you and I have in our units, right? However, there are going to be times when folks are going to choose housing that has additional lease addendums. So an example is, you sign this regular lease, but then you also sign this addendum that has like 5 other rules. You have to be clean and sober. You can't have visitors. You have to go to a Bible study once a week. There's lots of things you see out there in housing that's not so legal. I don't say legal, but it takes away their full rights of tenancy. Suddenly they have these additional things they have to abide by to live there. And so really ensuring that they understand what their rights are, what the landlord's rights are, and what they're signing in their lease. I always give an example of, you know, I was helping this individual sign a lease, and I always tried to make it a best practice to go out with them when they sign their lease to ensure that they really understood what they were signing. A lot of times you have somebody that's hasn't been housed in a long time and they could care less what that lease says. They're signing their name away. They want somewhere to sleep tonight, right? So I try to be there for a number of reasons. One, do we know if they are able to read or write? Have they disclosed that to you? Are we making an assumption that they can go sign that lease and understand what they're signing, right? So being there just to support them in Do you need help understanding what this means? An example of this is I had a participant that was looking for housing. He was a gentleman that had frequent health and safety checks. And those health and safety checks sometimes would include police, ambulance, crisis workers, us as case managers, right? And that looked like a lot of traffic and a lot of people just in and out of the apartment all the time, right? And we talked to the landlord. We actually had some disclosure with the landlord. He was totally comfortable saying, you know, this happens. This is the kind of support I need in my home. And the landlord like, no problem, not a big deal. Fast forward a couple of weeks and we're signing the lease to this place. And one of the things they were asking him to initial was that every time an emergency vehicle showed up at their unit, they could charge him $100. This is somebody that was already on limited income, right? And I knew the minutes that I read that this person would be in debt to his landlord within the first month or two, because we knew that this was going to happen already. And he was getting ready to sign that baby. And I said, whoa, 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 hold on. And I turned to the landlord and was able to advocate and say, remember that day when we talked about the health and safety? And she was like, yeah, well, listen, this would cause some issues and he wouldn't last here. And we really want to make sure he can stay a place that's going to support that and understand that that's what's happening. And she was willing and able to waive that part of the lease so that he could still live there, because they understood, they knew about it. It was agreed upon in advance. And had I not been there, he probably would have signed that and been held to that piece of the lease, right? So advocating in those moments is totally okay. And as much as they allow us, we want to be there to support them to go through that, because again, he just wanted a place to live. He loved that apartment and he just wanted a place to live, and he would have signed anything at that point. But I wanted to make sure that we weren't going to put him in a situation where he wouldn't be able to stay long-term. So we had that conversation. So having them understand, these are my rights. I can advocate for myself. This is what my landlord's expected. This is what they can do. You ever get somebody that's like getting in trouble, getting notices for smoking in their unit, and then they come to you and you're like, Kimberly, can they do that? And you're like, well, hey, I have your lease in my file. Let's go take a look and see what you signed, right? And then you can go, yeah, you kind of signed a thing saying you wouldn't smoke in your unit. How can we help you not get evicted for this, right? What can we do to help you find ways to smoke outside, right? So you don't get in trouble for this. And so really having the time, spending the time to have them understand what they can do, how to advocate for those things, and then really understand what their rights are and what the landlord's rights are so important. And then, you know, as you think about what's in a lease, if you guys are somebody that is owning your own housing, thinking about what you're putting in your own leases, right? To ensure that folks are able to be supported well and not putting a lot of barriers up that may be more difficult for folks. So we really ask that we do keep leases in our file, even if it's an Oxford agreement or recovery house contract. A lot of times those aren't full legal leases, but it tells the participant what their responsibility is and what they can do if something doesn't go right. So really thinking about how we're hanging on to those things. Our folks aren't always great about keeping paperwork. And so them allowing us to have those in our file allows us to really support them better, right? And so thinking about those things as we're thinking about leases and rights of tenancy. Co-access to housing is one of my very favorites. This is all about what are we requiring of folks before we'll be willing to house them. So this is an interesting thing, because a lot of times we'll say, well, we're housing first, but then we'll start doing some fidelity reviews and hearing case managers go, well, you know, I don't start housing them until they have some income. Or, well, you know, we don't really like to work with them until they have certain life skills, right? And suddenly our own biases can sometimes get in the way of helping somebody just get housed when they're ready to be housed, right? The idea is if my participant comes in and says, I'm ready to be housed, I say, okay, let's do this. Not, well, you know, I don't believe you really have enough life skills to be successful. We don't want to ask them to go through a program or live in transitional for 6 months to prove they can do it independently and then come back and maybe do the hokey pokey, see a clinician, and then we'll talk, right? We really want people to feel like they can just say, I'm ready, and we're going to go for it. There are lots of times when one of the things is, did any of you have full life skills and were ready to live on your own when you moved out your first time, right? I always say that's, that's hilarious. I was like 16 and no, I did not have all the life skills, right? I couldn't even do my own laundry, right? So at that point, we have to think, why would we expect that of someone else if we didn't necessarily have those same skills? That's what we're here for. We help get them housing and we help them build those skills and be able to become more independent along the way. We don't have an expectation that we won't serve you and support you in housing until you prove yourself to us. So really thinking about what we're saying to participants, the things that we're having them sign before we start working with them. So our policies are really important in this, and really helping them understand that they just have to say, I'm ready, and we'll start supporting them in that work. Are we prioritizing folks who maybe have a harder time maintaining or sustaining housing? So a lot of times people go, well, Kimberly, FCS is already kind of prioritizing the eligibility, right? We already do that. And that's true. But are you thinking about, is it first come, first serve when you get those referrals? Or do you guys think, well, this person can't get released from the hospital because they have a health condition until they have somewhere stable to live? Or are this person unsafe on the streets because of this, and we need to make sure they get prioritized? Are you prioritizing a certain population that gets referred? Well, we're working with all of our chronically homeless first, and then the people that are maybe, have somewhere to stay or sleep gets next, right? So really thinking about how you're prioritizing the population you serve, thinking about that, and having a really good policy in place about what that looks like, so your staff knows whether you have prioritization or not and what that is. A lot of times we go into agencies and see, it depends on who you talk to, what the priority is, right? And we want to make sure that it's really aware to the staff who's providing services what that priority is and what that looks like if you have one. If it's first come, first serve, write that in your policy, right? So that we know and so that they know what that looks like. And then are we making sure that folks have privacy in their units, right? So are you able to just go in and do a random inspection whenever you feel like it because you haven't heard from them in a while? Or do you wait to be invited in? What does that look like? What is your policy around staff entering units? What would you want if you had somebody supporting you? Are you letting anyone just walk in whenever? I grew up in a house where someone could just walk in whenever, and I hated it. So as an adult, I used to lock my front door. Like, no one's coming in unless I ask them to come in. That's how it should be, right? We should be invited in before we just assume we can walk into somebody's unit. We shouldn't be able to just take the keys and walk in and say, you know what, it's time to inspect your unit. Here we are. But really being mindful of what we're doing and what policies we have in place to support that individual and making sure that they have their own privacy. And the last one is flexible and voluntary services. This is a bigger dimension, but really it's all about how we're serving folks, how we're being flexible in the way we serve individuals. Are we allowing them to guide their services? Do they get to pick and choose what services they're being offered? Or do we say, this is what we offer, take it or leave it? How are people really going to be supported if we're not asking the questions of what do you need? What do you not need? What can I do to support you, right? What am I doing and getting in the way of supporting you by trying to require all these things of you, right? Are we allowing them to choose where we serve them? Do we meet them in the community? Do we expect them to come into the office? Are we going to their home, right? So really allowing them to tell us what works best for them and what they're comfortable with. Yes, we want home visits. Home visits are really important to seeing how somebody's doing and being able to kind of meet them where they're at, but that's really what it's about. Yet we don't have to go to their home every time we meet with them. We can't expect them to come to the office every time we meet with them. Allow them to tell us what's most comfortable, because the more comfortable they are, the more engagement we're going to have with that individual and the better we're going to be able to support them. Can they modify the goals they've set with you? Are you dictating what goals they set, or are you letting them really guide that? And then are you allowing them to change their mind, right? Are we saying, okay, well, that's the only goals you can have for 6 months now, that's it. And we can't change in 6 months, we can look at this again and we can change it. Or can they 2 weeks from now go, you know what? I don't want to do that anymore. I want to do this instead, right? And then making sure we're documenting those changes so we can really make sure those treatment plans, those goals, those service plans are really a living document and should be modified as needed, as often as needed, right? that we are looking at those every time we go to an appointment to ensure we're staying on in intentional services with somebody, and that we're not trying to do something that is totally off what we had talked about doing with them. We're really allowing them to tell us, I want to work on this, and until I change my mind, that's what we'll do. And then if we go back and visit them in 2 weeks, they're like, you know what? I've changed my mind. Can we do this instead? And you say, absolutely, let's do that instead. Are you allowing somebody to have no services? So you get someone housed and suddenly you're like, they don't engage with me anymore. Well, yeah, sometimes that's all they needed from us, right? Sometimes the hard part for them was getting into the house and getting on their feet, but they really know how to live independently. They really can do that piece and they don't need that support. Are we allowing them to say, I'm done, I'm good, thank you, and goodbye, right? Or, hey, I might need some support down the road. I don't want to close out, but maybe not see you as often. Maybe can we meet every 2 weeks instead of every week, right? And allowing them to really decide what that looks like. Let's talk caseloads for a minute. I know we all talk about, like, you know, caseloads can be all over the place, and Dawn and Darren talked about caseloads for employment. We have similar standards in the way that we hope that we keep our caseloads small. That for perfect fidelity, or that optimum caseload would be 12 to 15 people. That seems like not very many people for a full-time employee. However, we have to stay really intentional on the services we're providing. We are doing intensive case management. This isn't just like checking in with someone once a month. The majority of our folks need us more often than that. And besides the fact that we're meeting with them more often, we're coordinating care with their other providers. We're doing documentation. We're out there doing landlord search for them, right? And that all takes time. And then you all have those other duties as assigned by your supervisor. We all know they're there. So you have to have time to do all those things and still serve your folks well. So by keeping your caseload small, we know that you're able to stay intentional and really support those individuals. I would say don't go above 20, then you're really pushing it. I remember having 26 people on my caseload doing these types of services. I was never in the office. I was doing documentation at home, right? And I was really overwhelmed because we're doing a lot of things to support these folks. It's not just meeting with them every once in a while. So making sure that we're really thinking about that, and we're not burning ourselves or our staff out in the way that we expect. I want you to have this many caseload of SCS, and then you're going to do 25 of rapid rehousing. And then, by the way, I need you to support Joe in doing GOSH because he needs help sometimes, right? We really want to keep those roles defined and keep people kind of in their lane so that they can stay intentional in the support they're offering and be able to really wrap around somebody like we hope FCS does for folks. And also coordinating care. You guys heard me talk about that. And really thinking about, we're not the only ones helping somebody stay housed. Some days it feels like that. I say it takes a village because it really does take a village to house somebody. Some days it might feel like I'm the only one doing all the housing stuff, but really, are we coordinating with their behavioral health, right? We need to, if they're engaged with behavioral health, are we trying to get releases so we can all be on the same page? What about their SUD provider? People hate sharing their story 25 times. That can actually be traumatic for folks. Are we all trying to engage with each other to ensure that we're on the same page and supporting that individual? So staying really holistic by having releases with their behavioral health, having releases with SUD. Maybe they have a provider that's offering their rental assistance. Do we have a release to talk to them? Their employment specialist, right? Really wrapping around somebody and providing services as a team really allows us to focus on all the things that are important, not just housing because it's the crisis, right? But it allows us to kind of focus on all the things that are important in having somebody do well and move forward in their recovery. So thinking about that, and how are we staffing with our mental health providers, right? We may have a release of information, but maybe we can set up a time. We work with 3 agencies all the time. Maybe we can go to each other's staff meetings once a month, or just have a check-in on a regular basis that talk about our shared participants. Do we have a good referral process? What does that look like? So really thinking about how we're serving our individuals in that way. The other side of that is how are we connecting as a team to ensure that we all know what's going on within our FCS programs, right? So that means good supervision, having not only group supervision, but one-on-ones with our supervisor to talk about things that are going on. And then really working as a team to know that we can back each other up when it's needed. Sometimes we need that second staff. Sometimes we go on vacation or have an emergency and have to step away. Is there somebody that can step in behind you and support your individual? Is your documentation good enough that somebody would know what's going on, right? So having time to really talk about, hey, you know, and helping each other to support those, you know, sometimes those hard scenarios that happen with individuals, and you're like, I just don't know what to do next. Can you help me? Can you help me brainstorm some ideas of being creative and supporting this individual? That allows them to be backup. It allows them to know what's kind of going on with you guys, with your own participants. And then also offers a way for you guys to support one another when things come up and you can't be there to support your individual. We sometimes get stuck in this, they love me, and so I'm the only person in the whole world that they'll work with. And if something were to happen and I had to step away, what would happen to that participant, right? I actually had that scenario happen. I had a participant that refused to trust anybody with anything. She was in behavioral health. She was in our SUD program. She was in our housing program. She was in crisis. And yet I was the only individual that she would talk to and allow to even have her phone number. She was getting meds from our clinician, right? But anything, every appointment, every interaction had to go through me, no pressure. And yet what happens when I can't show up for work one day, right? So we had to work really hard to get her to start trusting other individuals on the team. I started bringing a second staff with me and just kind of introducing the idea of maybe another person being able to be her support. And eventually she allowed the clinician to have her phone number, right? She allowed this other person to come support her in her housing. So we may have folks like that, and we need to be able to kind of warm up to the idea that it takes a team to support our folks, and it can't just be one of us, because there's lots of scenarios where that can come into play. And then the last piece of this is, are we being flexible in how we're serving folks in? Are you 24/7? Do you have people kind of staggered in the shifts? Are we allowing our staff to flex time to ensure that we have, you know, we can serve people? Can we come in late or show up early to make sure that they're being able to see units or get the support they need, and really being flexible around what staff can do to support individuals? This is really about that wraparound. I like to show this because, are you asking all the things that people need, right? What do they need to support them? And can we make sure that they have those connections? As a housing specialist, part of our job is to make sure that we have connection to those other folks that can support us in the work that we do, right? And so we may be doing housing, but can their housing or can their behavioral health peer or case manager support them in getting their meds, right? So that we're not ending up doing everything for them, because, right, that burns us out. It doesn't keep us intentional on that housing support. And it can take a lot of us that we can support each other in making sure that they're served well. All right, that was fast and furious. Those are the principles of supportive housing. Any questions around these? Thoughts, comments? It's quiet. Are you guys all experts now? Just know that that's what Rayanne and I are here for. That's what Dawn and Darren are here for. As you start to implement these or think about these, you can reach out and have us go through them and connect you and support you in figuring what that looks like for your staff. All right.
Thank you for all that great information, Kimberly. And definitely it really takes, you know, the roles and the leadership and encounters with executive leadership to really change the culture of an organization to adapt all these different elements and some of these core elements that we have addressed so far today. And it does take time to implement the changes and move on and, so to speak, get all your ducks in order to really launch this program successfully in different programs. But there's so much integration takes place. And from my experience in working in behavioral health for over 30 years, I was fortunate enough to be an agency for many years. And so people knew me, and I was able to be that advocate and be that champion voice with some consistency. And I know that's not always the case for a lot of agencies right now, but to really reach out to the employment staff, if you're in that executive role, to really learn about the program, learn about their barriers and the strengths as they're implementing this program. So, next slide. So here's the top, brackets for what we look at leadership in implementing evidence-based practices. And there's a lot of things about communication with the folks in the front line, in the trenches, with the champions and the team leads and the supervisors and managers, but also, that communication with executive directors, those people in the leadership role, and allowing access for the staff to have some conversations. I was fortunate enough in my role, I had meetings with the executive director twice a year, just so I can be able to share some of the things that were going on during those times. And in between, I was able to share data and really focus on success stories. So there's different ways and different strategies to get people's attention, and I'm not going to minimize how precious leadership and executive time is to share with an agency, and some agencies are quite large, so I know there's a lot of competition for time. But implementing an evidence-based program really takes a lot of people at different levels to really come together to make this rollout successful. Particularly the person who's going to champion supportive housing or supportive employment, and those individuals being aware of all the different principles and some of the expectations, as well as some of the barriers of implementing the program. I think I can speak for all the trainers that we all have experience in implementing programs, implementing these best practices. So we do have some of that strategic knowledge and things that have helped breaks through some barriers, and also some ways to have that continuity of information and communication to link up with the executive team. In my experience, I was able to coordinate with the development team, with the HR team, with clinical directors and the CEO, very valuable access points to share information. But I also know that there was some success, because when we had, prior to COVID, when we had agency meetings and different meetings, different programs would have that ability to share what was going on and share those experiences. So definitely it was a great payoff for our program, because we're able to, implement these evidence-based practices, but we also had that opportunity to share success stories across the platform for all the programs in the agency. Another important piece is, quality assurance. Evidence-based programming is based on quality improvement, what we're learning and how we can draw others to learn and share some experiences. For the SE side, supportive employment, we have a fidelity scale. So it's a useful tool that can be blended into the quality assurance process to look at certain aspects of these elements and how the program is currently matching, maybe exceeding, or maybe needs some more support to do that, and look at strategies to pull in other resources and time to help facilitate the process. And sometimes it can be, a straightforward fix about adding something about employment into supportive employment, or employment into an agency intake. But when you do that, now you're pulling in IT time, clinical time, changing forms. So something that can even seem simple and basic on the surface can create other departments and leverage time and resources to make some of that momentum happen. Definitely on the SE side, there's a lot of data quality matrix elements about job placements, time in the community, how many employer contacts, all that kind of information, which can be really great information to feed leadership that reflects what you're doing out in the community, where the program is focusing resources, and look at some of those positive outcomes. I always love taking this information and packaging it and working with our development staff, because then we could share the information with our stakeholders in the community. When I had some grants with the counties or with the cities, it was always great to tie in my data into these different entities, and it really helped get renewable contracts year after year for some of the municipalities that I worked with. So it can be valuable, but I also think just to reflect on what people are actually doing in the program and putting it in a data package to share with the agency and across all the platforms. Because if we're changing the culture that individual choice is important, that housing is critical, that employment is critical, and working together, we can bring people out of poverty. It really impacts all the different platforms within the agency. And I think it's important for those folks to know where the process is and how those changes come to be and the impact on individual lives through success stories. Supported employment also looks at the development of a steering committee. And what we look at that is building a committee of stakeholders, individuals with lived experience, employers, executive team, could be employment specialists. It could be bringing in people from Division of Voc Rehab, DDA, all these different elements to come together and look at the program and provide constructive feedback. Definitely, this could be a very powerful tool in enhancing and strengthening relationships with you have providers now, but also give the employment staff another influence and feedback and changes to make and improve the delivery of supportive employment services at the agency, and really looks at a higher level of integration in the community to focus on employment outcomes. Next slide, Kimberly. So definitely there's also best practices, and I think everything we do, and here's a few for just looking at the recruitment and the hiring of different staff, because I think it's helpful always to have you know, a game plan, and it's also fair to let somebody new that's coming into an agency what they can be aware of. Definitely, in my former role, I was the one doing notifications for jobs. So I was able to implement a lot of the key elements that I needed in terms of recruiting for employees. You know, have that job description that you can use and that you can use for marketing and recruiting for folks. And also have a strategy, you know, definitely feedback I used to give our recruiters where we're getting people, or maybe other opportunities to extend our recruiting strategies to get people involved with the program. Sometimes those, you know, focusing on people who are certified peer specialists and looking people with lived experience. Sometimes it might be looking people with business experience and familiarity with the business language to kind of help with the job development. Internal as well. I used to always try to look at other departments for individuals I work with and try to encourage them to look at employment services as maybe a career option that they can work on to really build. I think it's a really powerful tool if you can recruit internally for some of the positions, because people already have some of this industrial knowledge that they can use and kind of leverage and really build the program. And I think it's always good to always use the fidelity scale. It's a roadmap for evidence-based practices. It's also a roadmap to help you do some recruiting, because people need to know that some of the focus is being autonomous, working in the community. That's not everybody's bag of tricks in terms of comfort level and being responsible for specific outcomes. Definitely, I know a lot of staff in behavioral health organizations and SUD businesses, clinics also have a lot of outcomes, but some of our outcomes are a little bit more unique in terms of being in the community, taking individuals out to the community to meet employers. So there's a lot of different levels of integration that would be different from some of the other clinical programs out there. And also think about who makes a good fit and what you would want to ask to be able to bring some people together. Just like I said, they have to be comfortable in managing a caseload and managing things out in the community, whether it's with employers or with landlords, but also with other stakeholders and providers. All my staff would go out and work with the Department of Voc Rehab to build those relationships and build relationships with employers. Sometimes it takes somebody out of that comfort level and put in a new situation. Some people can really grow and become subject matter experts and be real leaders in the community, where other people, that's not quite their comfort level and maybe need a different kind of environment so that they can be successful. So I think I was going to share this slide deck with Ryan, so I'll hand it over to you, Ryan, for the remainder of the bullets.
So, I mean, I definitely want to recognize that like our hiring culture right now and like the amount of folks, you know, that we're struggling to see with turnover and that kind of stuff, like it's hard to find folks. And so I can recognize numerous times in my past with teams, like sometimes it's, do we just take a body, like, because I just need a person, or do I hang on for a minute and hope that someone better will apply? Like you have to make that choice. But I think in general with that, once you make that choice to know that we're available for you, right? There's agencies where they contact me and they get someone newly hired and we just sit down and we do some training, right? For a couple of hours, that kind of stuff to build that capacity for those supervisors. And then I just wanted to add a little bit to Darren's section kind of about the interview process, right? I had so many staff, so part of we'd hire, do all of that stuff. And then after 30 days, I would ask them kind of across the board, what did you wish I would have told you in the interview? And would you still have taken the job, right? Like, had I told you that, would you have changed your mind? And more often than not, it was the like, it was like the nitty gritty, right? Like the, well, I didn't understand that there was no money for supplies, right? My program was really, really poor. And that's something for them was a really big, like, I don't feel supported because I don't have a budget. I don't know that I can buy a planner and pens and, you know, all of those things. I kind of just got what I got when I started, right? And I'm like, yes. So really giving them that information right up front. I used to have the kind of just open conversation of in housing, and I was running a PSH program, so we had a lot of people who passed away. So we had to have that conversation right from the get, right from the very beginning to say, hey, we come face to face with death just about every day, and we talk about it a lot, right? Like, so I need someone who can be comfortable in that conversation, who can be comfortable challenging back and forth, right? To say, I wonder what we should do here, or maybe we miss it here, or and I'm sad, right? Like I lost my human and I'm sad, but this is what I'm going to do for myself to make sure that I can love on the next person. One of the other feedback, just kind of avenues that they gave was some of the interview questions. They really appreciated the like situational questions, right? Like we had a really just silly one, but it absolutely has happened like 100 times, where you like walk into an apartment, right? And the carpet foam is just floating throughout the unit, and the refrigerator is in the kitchen, or I mean, the refrigerator's in the living room instead of the kitchen, and cabinets are off the wall, and this person's running around their apartment, right? Like, what do you do? Because that is very much a situation that a housing person might walk on, you know, knock the door, the participant opens, and you're like, oh, okay, like rechannel where I was going with that today. So that, and then just asking some simple questions to really get at what you want to know, right? We used to ask all the time, why do you think people become homeless, right? Because that really just filtered out some of those. I'm like, nope, that's maybe not the answer I'm looking for on my team. And transitioned it to, why do you think people remain homeless for so long, right? That really got me to the candidates who are able to give me that kind of systematic view, who could look outside of just them and themselves and their experiences and say, I think maybe it's lots of things, right? I wasn't looking for any particular answer, but how does your brain work? What does it look like to you for homeless services? And then I would ask questions about, how do you think Spokane, I'm local to Spokane, so how do you think Spokane's doing addressing homelessness, right? Whether I agree or not or whatever, it just gives you some insight to know that when they sit down with that human for the first time, that they've got it right down to their core, that you know that they want the very best for that person, and they're willing to ask for help if they don't know how to do that. So just kind of across the board, I definitely recognize hiring is so hard, and you guys know that, right? Like you guys know that, and the more investment that we can put up front, where staff feels confident, we can build on momentum, we can get them the tools that they need. We want to do that instead of, they start out so excited and then they really struggle for a while, and not until they're really struggling do we say, I'm noticing some behavior change. I'm noticing that you're grouchy, or I'm noticing that you're not participating in stuff. What's going on, right? We can kind of offset that and get them as much resources and support as possible at the beginning. We want to be able to help you guys do that. So if any of this kind of realm of the hiring, that kind of stuff, just reach out and we'll help you the best we can. Thanks, Darren.
Yeah, thanks, Ryan. Great input. I think we're going to hand this section over to Dawn.
Yes, indeed. And I'm gonna add one more thing related to that hiring of folks. You've all hired. There is no doubt you've hired. And I'm going to speak to supported employment staff and one of the differences there. I did supervision of a program that, for 30-ish years on supported employment, but one that did IPS towards the end of the employment that I had at the behavioral health agency that I worked for. Over the period of 21 years that I was there were probably 3 staff that were hired that did not believe in the ability of people with disabilities to be successfully employed. And so when you're asking questions, in my mind, one of the most important things is to find out about how confident they are that people with disabilities can be successfully employed in the job of their choice with support and assistance. The individuals that I'm thinking of, it was like pulling teeth, the staff, to get them to go out and talk to employers. Finally, one of them was very close to being fired because she simply would not do it. And what it came down to is she didn't believe that the folks that she was talking about were really going to be successful. How do you change that mindset? So once you've hired the staff, how do you kind of instill that in them? In my mind, it's sharing success stories. Because I will tell you, I took the job that I had early on because I was asked to apply for it. They wanted me because I'd been in another program. They were pleased with the results of that other program. I had worked with individuals with intellectual disabilities, and I had some pretty good skills there, but I had yet to work with people with serious mental illness. So I was a newbie 25 years ago to that population. I didn't necessarily believe in the abilities of folks with serious mental illness to be successfully employed. What it took to change my mind was seeing success stories, was getting to know individuals that were receiving services and seeing how successful they would be and in what circumstances and with what support. So I can't stress enough for your current staff, for new staff coming on, for stakeholders and partners, sharing of success stories is huge. That's part of how we decrease stigma. It's part of how we help staff to feel fully confident about the ability to serve people with serious mental illness. So that's a little rabbit hole that I definitely wanted to go down because there were 3 staff over a period of years that were absolutely unsuccessful as employment specialists. Others that, it was maybe not their favorite job, but they still did it. And that some that absolutely shone. Probably the best employment specialist that was on the team ever was a gentleman that had worked for the local newspaper doing sales. He had essentially no social service experience, but he had the right attitude. He knew everybody in town. He's still in the job, last I heard, and their employment rate is massive in regards to people they can help to get employed in jobs where they're actually maintaining that employment. So I say he didn't have social service experience, but his wife was the program manager for the SUD program within the agency. So by osmosis, he had some, but he was probably the most successful person. So don't discount somebody that may not have that direct social service experience. If they've got the right philosophy and they care about individuals and want to see people improve their quality of life, maybe take a shot. So supervisory considerations, I'm not telling you anything earth-shattering here either. But these are things that are relevant to individual placement and support. That supervisor really needs to believe strongly in zero exclusion and be willing to bring that up. Zero exclusion and implicit bias. They need to be willing to champion that cause with other teams, with, maybe even staff on the same team that they're on. They need to be able to speak to why zero exclusion works and what it actually means. Within IPS, I know within permanent supportive housing, I think Kimberly was saying, if a person says they want to be housed, yeah, go for it. If a person says they want a job, yeah, go for it. I know that when we've talked to DVR in the past, they have sort of different standards than we do. And over a period of time, they believe that folks that are actively using substances or actively drinking can't successfully be employed. This is going to sound irreverent, but how many of your colleagues do you know that either drink or use drugs and they successfully go to work on a day-to-day basis? Let's be real and not expect of the folks that we serve something different than we expect of our neighbor or a friend or a family member or whatever. So zero exclusion really is zero exclusion. One of the things that I see, especially with new agencies, is that the supervisor so very often ends up wearing so many different hats that they may or may not have time to go out with new staff to do the field mentoring or to do the supervision that needs to happen. I know what it's like to start new programs. I know that you do your best with very limited staff, but be very mindful about your supervisors and that they aren't wearing so many hats that they can't go out and do the field mentoring or just mentoring in general that's needed. Integration and collaboration, be a silo buster. The agency that I worked for, 25 years ago, because I've been gone for 4 years, I joked about the fact that my office was the Harry Potter office. I had an office under the stairs in the basement, and that's where our records were, and they weren't included with the other records. The gal who did quality assurance didn't want auditors to see the information about supported employment, which means none of my colleagues did either. We were not considered clinical once upon a time. We didn't get to go to team meetings with anybody else. We had our own team meetings, but we had to really look for our colleagues that were also working with a person on our caseload in order to be able to staff and collaborate with them. Fast forward to IPS and to the fact that therapists and case managers and the medication management staff and the crisis staff all started seeing those success stories and how people changed for the better, for the most part, when they were employed. Every once in a while you'd find somebody that it wasn't their thing, but that was rare. For the most part, when people became employed, they became much more functional. They had much fewer in the way of symptoms. Life in general was just better. And the more we did that, the more we were invited to team meetings to talk and accepted as part of the team and accepted as having clinical skills, that we could help people to learn coping skills. We learned those coping skills ourselves by being in those team meetings and being in training with the rest of the clinical staff. And so went from the Harry Potter office to being in close proximity to our colleagues that were referring to the agency and actually doing a lot with them. One of the principles talks about proximity to the staff that are referring to the employment staff. How many of you know the power of water cooler conversations? Everybody. And that's part of the reason why you want to be able to collaborate. And part of that collaborating is being somewhere close in proximity to the folks that are sending referrals to you. So consider that also when you put the program together, when you hire your staff, or if you're transferring staff to a position, pay attention to where those offices are located. Pay attention to whether they're close to the people referring to them. Set and monitor goals for supported employment team. My suspicion is that everybody in your agency is going to have a 6-month or a yearly or whatever performance evaluation, and that's wonderful. That's great. This isn't necessarily talking about that. This is the kind of thing that the principals say that in order to kind of put it all together, you need to go out and talk to employers, 6 employers a minimum per week. Each employment specialist needs to do that. Face-to-face conversations with employers, 6 of them per week. Let's say a person's doing 1 or 2. Maybe the goal is they bump it up to 3 a week. Maybe then the next, couple of months, it's that they bump it up to 4 a week. Doesn't have to go from 0 to 60, but know what the staff are doing. Set goals to improve to come closer to fidelity, which bottom line will come closer to achieving those outcomes of people successfully getting jobs. Tracking data. You already have your system set up for tracking a number of people employed, and not necessarily just in the employment program, but served by the agency in general. Do you have the ability to track that data? Once people are employed, do you have the ability to maybe run a report related to how many people have been employed in the same job for 90 days or more, 6 months or more? Those are important pieces of information. Are you able to pull up a report or look at a tracking form that shares information about who are your staff going out and talking to for jobs, or for that matter, landlord contacts? Do you have those tracking forms in order to know that people are going out and talking to multiple different folks, tracking employment contacts, landlord contacts, and things along that line? Along the same, if it wasn't documented, it didn't happen kind of thing. Do you have a documentation form for documenting team meetings and supervision? Part of the thought process there is, no doubt, if your supervisor changes, and during COVID, it's been mind-boggling to me the number of staff that have, direct service staff that have left, but also supervisors that have left. You don't want them to have to start from the beginning. You want them to be able to go back through those minutes and see where you're at and the things that have been worked on, and hopefully the things that are improving over time. Success stories I've probably already kind of beat to death. So very important to share within your agency, both the staff at all levels and also other people receiving services. That's something I have to say very honestly that the agency they worked for wasn't very good at. I think we allowed HIPAA to paralyze us related to sharing success stories, and particularly individuals receiving services, sharing success stories with other people receiving services. I truly think we let HIPAA be the reason for not doing as much of that as we could. There are just lots and lots of agencies out there that do a marvelous job of including the information in newsletters, including the information in success stories that are posted in common areas. Maybe bringing in people to speak to, let's say your agency has a ADL group of some sort, and you have a participant come in and speak to that group about their successes. There's lots of ways to do it. Don't be like what our agency was. Don't let HIPAA paralyze you. Mentoring out in the community, and that's once COVID restrictions lift. I know different areas, different communities are kind of at different points still. But truth be told, I think some of the most important mentoring that's done is that modeling of the behavior by the supervisor out in the community. So encourage your supervisors to do field mentoring. Encourage them to be knowledgeable about job development. It's surprising to me the number of supervisors in supported employment programs that know nothing about job development and training so that they can adequately teach staff. It's another area where Darren and I are happy to do that. Happy to provide training to new staff and to new supervisors. on more than one occasion if it's needed. You know, we learn by repetition, so don't be afraid to ask. And then supervisors, for the IPS principles, and if you look at the fidelity review manual, that's like 200 and some odd pages and explains in much greater detail what it is that you're looking at. One of the items says that encourages supervisors to carry a small, very small supported employment caseload. You know, consider the idea that they're going to be much more in touch with what their staff's going through if the supervisor has a very small caseload. Next slide, please. I put Kimberly to sleep. Teasing, I'm sorry. I have one of those voices. Supervision tools and considerations. We came up with a number of things that are helpful for staff, but in this day of technology, and I'm sure you've all found with the pandemic and the different virtual kinds of things we've all had to do, that first and foremost in this list of tools and considerations is a good laptop, a good cell phone, the ability to do that virtual meeting kind of wherever is needed, having tracking tools like a job development log or a landlord contact log or a participant log can be incredibly helpful for a supervisor, especially when they're spread as thin as typically they are, because I know they are. But to be able to track, you know, when did this person start in the program, whether it is that went out and talked to an employer, you know, how many job developments per week is this staff person done? How much time are they actually spending in the community? So having those tracking tools makes supervision so much easier and so much more efficient. I encourage agencies to take, and it could be the scale or the IPS scale. Take the scale, look at each of the items with the new program, determine if you've got a way to document each of the things. Caseload size, number one on the fidelity scale for supported employment. That's pretty easy. Hopefully you have the ability to know exactly who each staff person is serving, who's on their caseload, and you can pull up those things. When you get to things like, well, the job development, if it's just documented in progress notes, the supervisor has to pull the charts of the employment specialist and go through each progress note to find where the job development happened. Not helpful. Documented, and that's great, but makes the supervisor's job so much harder. So one of the things that I was always taught in supported employment, and I suspect you've all heard this too, is from a funding standpoint, grade funding, don't put all your eggs in one basket, that programs are far more successful if they have more than one source of funding. And so one of the ways to do that is to apply for grants. Any grant I've seen in recent years expects to see how you're collaborating with your stakeholders, what kinds of success rates you've got with what you're doing, potentially see newsletters and that kind of thing, or articles or letters of support. Put those things together in advance potentially. Keep those things available so that you can apply for additional grants and additional funding as needed in order to help support your program. One of the really challenging things that agencies always run into when we go to fidelity reviews is how to show what time their staff is spending in the community. And it is hard, it's tough. I know the agency that I worked for once upon a time had Cerner as far as an electronic health record, and then changed to Credible. I know a lot of the agencies that we do fidelity reviews of don't have electronic health records. And so do they have a calendar? does the staff put on the calendar where they're going to be and when? And we made it very clear within the agency that we worked for that safety was of primary importance. My teammates and I have discussed a number of times going to conferences and things, how much more dangerous the world seems to be. And I'm sorry if that sounds negative. We talked about having gone to the housing conference in Seattle in April and how there had been shootings downtown where we were staying and going to the conference. You know, we end up seeing periodically people that provide social services, but especially if you're a behavioral health agency, being an outreach worker in a behavioral health agency or a crisis worker in a behavioral health agency, it's one of the most dangerous jobs that there is. So if you have that calendar and you know where people are supposed to be, and because they are supposed to be out in the community, and can track that and be able to, you know, then also pull it up when you have a fidelity or review or something, that's incredibly important. But the safety concept being such an important piece of it when folks are going to be out in the community. Any questions for any of the stuff that I've gone over? I see our timekeeper says we have 6 minutes until the end of time. I'm thinking the world doesn't end there, but probably this does. Teasing Rayanne. So what's next? And I don't think this next one's my slide. That's what's next.
Okay, so it's just a reminder of the trainings that we still are doing as part of the series. So both of us have one left. So if your team has not made the other two, connect to one of us, please, whoever's holding your contract. But the supportive housing one is on June 8th. That's a Teams meeting, Microsoft Teams, so we can send you the invite. And I believe employment, your guys' is a Zoom, right? So please pre-register for that. But that's it, just a reminder on that's still left to do.
And we're also, Rayanne, not to interrupt, but we have one more training to schedule with Paul and his team to answer some questions about prior fidelity reviews and kind of how to improve upon those, or at least some ideas and that kind of thing. So we'll be reaching out to do that.
And this is just a snapshot of the deliverables, as this is a deliverable that will complete for the agencies participating today, and some of the other deliverables. Check in with your individual contract manager where you're at with some of these to get the documentations so that we can complete the invoicing by June 30th of this month.
All right, guys, that really concludes our training. We have some future training opportunities. You guys know we're here to work with you. We have the trainers. We have a newsletter that goes out. We also do quite a few webinars across each month that we do on a regular basis, as well as some additional one-offs. So please reach out to your trainers, whether you're doing supported employment or supportive housing or both, to connect to additional trainings. Make sure we have your email to be on those listservs. We are so excited to be working with you guys and continue this amazing work of supportive housing and supported employment. There's also some resources. We will make sure you all get the slide deck after this so that you can connect to some of these resources. And again, please reach out if you have any questions about anything you've heard today or want to know more. We'd be happy to spend time with you to do that. Thank you everyone for coming today and spending some time with us. We know that was a lot of information, but we really appreciate you and look forward to working with you.
Yes, thank you all today for taking the time to join us for this information.
Thank you.
Especially thanks to you that have maybe heard the information before and sat through it another time. So I know some of this was not new to some of you, and I do so appreciate the fact that you sat through it anyway. So
Thanks everyone, and have a great rest of your week. Take care.